Good afternoon. It's 2 o'clock here in Florida. I'm Dr. Deukmedjian. Our patient travels from Stewart. She is an avid horse rider. She's had back pain for 2 years. And she's an interesting story because she highlights the problems of not treating your back pain or leg pain and letting it go, which is very common, by the way. A lot of people don't treat their back pain. They let it go. They just accommodate it. What does accommodate mean? It means changing your behavior so that it doesn't make the back pain flare up. That's what accommodation means, right? You can accommodate back pain in many different ways. Shot? One of the ways that you can accommodate your back pain is by, shot? Avoiding certain activities that make it worse. Shot? AP? The other way you can accommodate is by drinking alcohol or doing pills, pain meds, excessively. In the end, activity changes can actually be damaging to you. So, what kind of activity changes can cause damage? Well, the first one is postural changes, right? So if you change your posture to accommodate your back problem, then what happens is, AP, over time, you end up bending the wrong way, twisting the wrong way, walking the wrong way, because you don't want to set your back off. So you usually have a stiffened back, where you bend with a straight back so you don't aggravate your herniation. And that straight bending and twisting is what causes a piriformis muscle tear. You can also cause knee pain, knee pain, hip pain, ischial tuberosity, tendonitis. You get all these secondary problems that stem from not treating your back pain. Shot? Just about there, Dr. Berndes. Any questions from the audience? Feel free to type up your questions, and I will do my very best to answer them for you. But this patient has a herniation here at L5-S1. She's put off treating for a while. I don't think she felt comfortable with the recommendations from other doctors, and she found out about the Deuk laser disc repair. She decided this is the treatment I want. It's the least invasive and the best treatment out there. She has a herniation at L5-S1. You can see that on your screen. She also has ischial tuberosity tendonitis and a piriformis syndrome. We're only treating the disc today. What do you think, Berndes? Yes, no, maybe so?
Hello, can you open your eyes for me?
I don't.
Are you having any pain right now?
All right. So while we're waking our patient up so we can do our evocative discogram, our discogram, by the way, is both evocative and chromo. It uses dye as well as pressure to see if it reproduces the patient's symptoms. Are you having any pain?
Open your eyes for me.
No, we're good. Shot? All right, look at that. That's a giant tear and a big herniation. You can see the dye going around the nerve root coming out of the L5-S1 foramen. And you can see a giant tear in the back of the disc. That shouldn't be there. When you inject dye, it should stay within the center of the disc where Jordan has got the arrow. But the dye is not. It's busting out through a giant tear that's already there. And that's where the herniation came out already as well. Shot? All right, I'm going to leave the guide wire, take the needle out. We use the needle to get to the right place, which is the herniation. The dilator spreads the tissues gently so that there's no cutting or tearing of any tissues, which is why the recovery from this surgery is literally overnight. Patients by the next day are usually able to go back to a normal life. Shot? We expect her to be able to return to normal as well. Remember, it's her pinched nerve that's the biggest problem here. And that pinched nerve is what's caused her to have bad gait, bad posture, which has caused other problems like ischial tuberosity tendonitis. I'm going to take this back just a little bit. Henry, since we're talking about back pain, let's show the audience the many different causes of chronic back pain. I'm Dr. R. Deukmedjian with the Deuk Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Deuk laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Deuk plasma rhizotomy of the SI joints offered at Deuk Spine or Deuk Joint Institute. The 4th most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Deuk piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% 99% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Deukmedjian. Thanks for joining us. Welcome back. You see the 30 different causes of back pain. The most common is a herniated disc or disc injury. So we have been working on this herniation at L5-S1 with the laser fiber now for about 10 minutes. You can actually see the laser fiber coming out of the blue sheath. The blue sheath is just a protective plastic sheath. The laser fiber is made out of glass. It is a fiber optic glass fiber. It transmits laser energy from a machine here at her feet. It's the size of a giant suitcase. And what I want to point out is how little blue there is. Why is there so little blue dye? We saw on the discogram that we injected a lot of dye into the disc, but none of it's staining. What does that mean? That's an important finding. What it means is that this is all scar tissue here. All this white stuff is scar tissue and calcium because this herniation has been there for a long time. And when you don't treat these things properly with the Deuk laser disc repair, a herniated disc becomes calcified, it becomes scarred, it becomes worse, more degenerated. Using this technology right here, I'm removing the inflammatory tissue, the scar tissue, and it's getting all cleaned up. Why am I getting wet feet? Ooh, my sneaker is soaking wet. Very cold water. Anyway, do we have any questions?
At this moment, no current questions.
All right, so the point I'm trying to make here is the L5-S1 herniation for this lady is very, very scarred because it's been here. This looks like a 30-year-old herniation. All right, now it's probably getting worse over time, and she's gotten worse, but she's also developed secondary causes of back pain, including ischial tuberosity tendonitis, piriformis syndrome. We treated the ischial tuberosity tendonitis with an injection yesterday. That's an ultrasound-guided injection. We're also recommending she get her piriformis treated. She wants to wait and see how she does with the surgery, and then she'll come back later. She does live in Florida, so she can make the trip later. All right, this here is the end of the herniation. And I'm going to tell you, this thing was hard, very hard, like a fine semi-hard cheese. Right here is the last of the herniation. You guys see it? There's a little bit of blue. And we'll be done with this herniation in about 2 minutes. Any questions from our audience?
At this moment, no current questions.
All right, let's show the audience how a herniated disc causes back pain, but also how we fix it using the laser.
Disc injuries start with an annular tear, damaged nucleus. Pulposis herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922. Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800